In 2025, we're proud to be expanding our work to Tasmania's northwest, which is a major step forward in our commitment to improving health outcomes for your community. As a health promotion charity, we'll be focused on tackling the issues that matter most locally, from chronic disease to mental health. And as part of this expansion, we'll be investing in medical research, and we'll work hand in hand with health staff to identify and fund vital medical equipment and resources to enhance the care of patients. Our goal is simple: to ensure that your community has access to the best possible hospital and healthcare.
Northwest is a really interesting area. We've got remote, we've got regional, we've got rural, we have the whole gamut really. And our population has a lot of social determinants of health that are not great. We have the highest rates of cardiac disease, we have some of the oldest population in the state. So we really do struggle to provide the best, care that we can, given the demand that we have. We have a little bit of barrier around distance, obviously, between our sites, and we're a bit unique because we have 2 hospitals 45 minutes apart, whereas the other regions in Tasmania, for example, have 1 central facility. So there are some challenges in duplication of services. Access to transport for our patients can be a real challenge as well. We're really thrilled to be working with Clifford Craig, and we think it opens massive opportunities for us. One of the great things about us being able to work with Clifford Craig is our education opportunities and encouraging research development for all of our clinicians. From time to time there is equipment we can't provide, and we know that we'll have that opportunity to work with Clifford Craig and see if we can increase some of our access to medical equipment, the things that are really needed by our clinicians to support our community.
I think it's well recognised that in the northwest of Tasmania that we have specific challenges both with health and also with health service delivery. I think by changing the focus from urban settings, we'll be able to look at how we deliver our healthcare better, but also how we actually look at the underlying causes of why our health is different from the rest of the state. We're very excited to be in partnership with Clifford Craig. We believe that that will help build our research capacity in the northwest. One of our biggest challenges is around chronic disease, and if we were going to focus on one particular area, it would be about the prevention of chronic disease. We've got an ageing population. How do we support those people to live independently at home, and what are the interventions that the health and the communities can do that would improve that impact?
I'm primarily interested in pediatric respiratory problems. Initial study that I obtained funding for, we determined that our asthma prevalence in childhood was higher than the national average, and particularly so in children of Aboriginal origin. And we now have a follow-up study where we're looking closer at possible risk factors for this. As we've shown in an earlier study, we actually have more childhood asthma. It's incredibly difficult to obtain a national research funding, and this is where Clifford Craig enables us to do local research. An additional advantage is also that we can attract medical staff, nursing staff. We can also foster a culture of research locally.
We depend on fundraising because without community support we simply wouldn't exist. So it's really important for us to be out there in the community, telling people what we do and who we are, and giving them an opportunity to engage with the Clifford Craig Foundation.